Good evening. My name is Paul Helmuth, and I'm the Deputy Emergency Coordinator for the City of Harrisonburg. And I wanted to take a minute and thank you for joining me and the panelists on this COVID-19 Town Hall question and answer section where we talk about COVID-19 and the vaccines. If you have any questions you would like to submit, you can submit them on the YouTube live chat you can see on the right side of your screen, or you can put them in the comments below. Tonight, I'm joined by the panelists Dr. Laura Cornegay and Dr. Greg Jested. Dr. Cornegay is the Health Director for the Central Shenandoah Health District. The Health District is one of 35 health districts that comprise the Virginia Department of Health. The Central Shenandoah Health District includes the counties of Rockingham, Augusta, Rockbridge, Highland, and Bath, in the cities of Harrisonburg, Stanton, Waynesboro, Lexington, and Buena Vista. Dr. Cornegay graduated from the University of Virginia Medical School and is a board-certified internist who practiced in U.S. Navy, in academic settings, and in private practice for 25 years. She received a Master's of Health in 2012 and began to work as a district health director in 2015. Dr. Cornegay has truly been a leader in fighting the COVID-19 pandemic in our area. Dr. Jested completed his undergraduate degree from Penn State, attended medical school at the University of Pittsburgh, did his family medicine residency at the University of Virginia, and was notably trained under Dr. Norm Oliver, who's the current Virginia Health Commissioner. Currently, Dr. Jested is a family medicine physician and partner at Harrisonburg Family Practice. You may have caught him on both Facebook and YouTube where he's talked about COVID-19. You may have also seen him on segments of WHSV with the now retired Bob Corso. Thank you both for being here.
Thank you.
Yeah, thank you, Paul.
The format for tonight is I'm going to ask both of you a series of questions. They're in three categories: vaccine safety and development, vaccine access, and why get a vaccine. And then we will go to the Q&A section in the chat room and answer the questions that the viewers also would like answered. So to start off, Dr. Jested, you have the first question. What COVID-19 vaccines are approved for use in the United States, and what are the differences between the vaccines?
Yeah, the three vaccines that are approved for use currently in the United States are the Moderna vaccine, the Pfizer, and the Johnson & Johnson Janssen vaccine. The difference between them are the Johnson & Johnson is more of a traditional older technology vaccine that uses a vector, adenovirus 26, to bring in DNA that then transcribes for the target the spike protein for the coronavirus inside the human cell's nucleus, whereas the Moderna and the Pfizer vaccines are actually bringing right in the messenger RNA that codes for the spike proteins that uses the body's RNA already in your ribosomes to then basically, like a Xerox copier, make the spike proteins that then go to the surface of the cells, creating the rather robust immune response that they create.
All right, and Dr. Net, and you mentioned that there were three approved. Dr. Cornegay, can you talk to why the government has paused the distribution of the Johnson & Johnson vaccine, and should we be worried about if we've already received it as our vaccine?
Sure. Well, the Johnson & Johnson vaccine was put on pause due to some rare side effects that were noted in the public. So the side effect is a clot in the brain called a cavernous venous thrombosis. It's also associated with a low platelet count. Those rare side effects have been seen in 6 of over 7 million people who've received the vaccine. So, very rare side effect, about 1 in a million. Unfortunately, there was one death in a Virginia resident from this side effect. Basically, what this tells you is that our vaccine adverse event reporting system, which monitors for adverse events with vaccine distribution, is working just as it should be, that these rare events were picked up They were noted, and we put a pause on distribution until things can be looked into a little further. As I said, it's about a 1 in a million occurrence. All of the occurrences were in women. They were in younger women, about between the ages of 18 and a little less than 50. The Advisory Council on Immunization Practices, which is an independent arm of the CDC, is currently looking at these occurrences and deciding kind of how to proceed with the Johnson & Johnson vaccine going forward. In terms of people who've received the vaccine, they really shouldn't worry. Again, about 1 in a million people have had this rare side effect. It occurred about a week to a little less than 2 weeks after receiving the vaccine. So if you're far removed from having received that Johnson & Johnson vaccine, you should be fine. Things that people should look out for after receiving the vaccine that would indicate they should seek medical attention would include headaches, shortness of breath, easy bruising, nosebleeds, swollen legs, those kind of side effects. And certainly if you have any of those immediately after receiving the vaccine, you should seek medical attention. We'll know the kind of outcome of what we should do with the vaccine going forward, probably in the next week or so. I suspect that it will be available. There may be some restrictions on who we use the vaccine in, given the fact that all of these occurrences happened in younger women. But we'll see what the recommendations are. I think one of the things to remember is that with any drug or vaccine, there are always risks and benefits, and the benefits of preventing severe COVID disease or death, outweigh those very rare side effects, which occur in about 1 in a million people.
Dr. Cornegay, they talked about the surveillance that you said they've used for the Johnson & Johnson to put a pause on it. Are the other two vaccines safe? Are they actually FDA approved, especially with the fact that they've been developed so fast when vaccines normally take years to be developed?
Vaccines were studied just as rigorously as any other vaccines on the market. They do have what's called an emergency use authorization through the FDA for approval. In looking at that emergency use authorization, they again hold these vaccines to the same safety and efficacy as any other vaccine that's on the market. The thing that we don't have with these vaccines that we typically have for a full approval through the FDA is a year's worth of use in the population. So when the FDA looks at these approvals for emergency use, they look at the fact that what's going on in terms of a global pandemic, the risk of that outweighs any risks of allowing the vaccine to be used a little bit earlier. But again, the vaccines continue to be looked at very rigorously. The vaccine adverse event reporting system that caught these events that happened with Johnson & Johnson tracks for safety events related to vaccines. So that's a very robust reporting system. One of the reasons that these vaccines kind of got created on such a quick time frame was due to a couple of different factors. One is that we've had experience with 2 different coronaviruses in the past. The coronavirus that causes SARS and the coronavirus that causes MERS. So we have a history with these kind of viruses, and in fact, vaccine trials, had been in effect, with these other viruses in the past. So that kind of gave us a legs up for this current vaccine. The other thing that brought them to market so quickly was that the vaccines were being studied and produced at the same time. Typically, pharmaceutical companies would study a vaccine, make sure that it's safe and efficacious, before creating the production cycle. With the need to get a vaccine out quickly to combat the global pandemic, those processes were done concurrently. A lot of that money to underwrite it was provided by governments, particularly the US governments, and that helped with the development. But at the point where we had good data from a lot of studies that showed that the vaccines were both safe and efficacious, we also had a big supply of vaccines that we could get out to the public. So all of those factors converged to get these vaccines to market on a much quicker time frame than we typically see. But we can rest assured that no corners were cut in order to do that.
And Dr. Cornegay, during the trials, was there enough participant diversity as part of this?
Yeah, there really was. The trials included tens of thousands of people, over 30,000 for Moderna, Pfizer, and Johnson and Johnson. They include all ages, sex distribution, and about 30% of the trial participants were Black, Latin, Native American, or Asian. So good racial and ethnic diversity as well.
We're sitting here talking with Dr. Laura Cornegay and Dr. Greg Jestet and talking about the COVID-19 vaccines. Dr. Jestet, what side effects can a person expect from the COVID-19 vaccine, and which side effects should I be most concerned about?
Absolutely. Side effects are fairly common with these vaccines, all three of them. Not everybody gets them, but they are common. The common ones are, as one would say, sort of flu-like symptoms, which are very much like coronavirus symptoms, but a headache, fatigue, muscle aches, low-grade fevers. Those are kind of the big ones. Just general malaise, just don't feel very good, and those typically will start up within the first 12 to 24 hours and maybe last about 12 to 24 hours. So if there's a gap much longer than that between getting the virus and the onset of those symptoms, you actually may want to consider getting tested for the disease itself. I've actually caught a couple of those clinically where patients come in just wanting clearance to go back to work. And I'm like, not so fast. And we get them tested, and then bingo, they caught the disease even after being vaccinated once or twice. The concerning symptoms, the really concerning symptoms that Dr. Cornegay just actually touched on, are the ones that are associated with the reactions to the Johnson & Johnson vaccine, where you get what are called petechiae, these little red bumps all over the body that are little tiny spots where you're actually bleeding, severe headaches, really bad nausea, blurry vision, severe chest pain, even pain in your back, abdominal pains. These are signs that there may be actually the clots are not only happening in the brain, but also in other parts of the body as well. So if you got those symptoms going on, they are fairly severe, you should get checked out. But otherwise, the general malaise, low-grade fever, it's all mild to moderate headaches, those are pretty common.
And then, Dr. Jestet, if a person is severely allergic to certain foods, should they avoid the COVID-19 vaccine?
Actually, no. Food allergies are not a contraindication to get any of these vaccines at this point. There are certain allergies that you do need to be aware of that may be ingested orally that aren't really necessarily foods themselves. If you are allergic to what's called polyethylene glycol, or PEG, that's a usual ingredient that we have in products that are used for colonoscopy cleansings, colon cleansings. If you know you're allergic to that, then you don't want to get the Moderna or the Pfizer vaccines. And then there's another substance that is used with the Johnson & Johnson vaccine that is, pardon me while I just check that really quick. Just a polysorbate, it's a generic type of molecule. It's often used in food colorings, and actually the gel used in some bindings and medications and other foods. You know that you're allergic to those, then use the other vaccine. If you're a rare person that's allergic to both, so be it. But In general, just food allergies alone are not enough to really warrant not getting the COVID vaccines.
And Dr. Jestet, you mentioned that you had caught several cases where people had gotten the vaccine and their signs and symptoms lasted more than 48 hours and you had them tested and you found that they had COVID. Can the vaccine give them COVID, or can the vaccine change their DNA?
Vaccines cannot give you COVID. What the vaccines do is make your body generate these spike proteins, which are the target that you then make the antibodies robustly towards. That cannot cause COVID. This doesn't. The vaccine is not giving you the virus. Okay, it's making you produce antibodies towards a part of the virus, and that's a really different mechanism. The What was the second part of the question? I'm sorry, I just blanked on that.
Will the vaccine change my DNA?
Yeah, the vaccine, it does not change your DNA at all. The messenger RNA that's introduced with the Pfizer and the Moderna vaccines are quickly degraded after they do their job, and the DNA that's introduced with the attenuated adenovirus with the Johnson Johnson vaccine similarly degrades quickly and does not become incorporated or change your DNA in any way.
Dr. Cornegate, will the COVID-19 vaccine cause infertility or affect my pregnancy, or should pregnant women even get the vaccine? Dr. Cornegate, that question was for you. I'm sorry if I missed that.
Sorry about that. There's nothing in the mechanism of how the vaccines work to suggest that it would affect fertility in the least. As Dr. said, it doesn't with our own DNA causes the body to produce antibodies, which are really specific for the coronavirus and shouldn't have any effects on fertility. In terms of pregnancy, the Centers for Disease Control, the American College of Gynecologists and Obstetricians, and VDH all suggest that pregnant women should get the COVID-19 vaccine. COVID-19 can have severe effects in pregnant women, which could affect both the mother and the fetus's life. So it is suggested. As with everything that's being highly monitored, there have been over 94,000 women in the U.S. Who've been pregnant and have received the COVID-19 vaccine without safety concerns. The CDC has set up a specific COVID-19 vaccine pregnancy register that can, again, add that additional level of monitoring and data going forward. But it seems to be safe in pregnancy and is suggested because the benefits of the vaccine outweigh the risks of COVID-19 infection during pregnancy.
Thank you, Dr. Cornegate. Dr. Jestet, the state has now opened up vaccines for everyone 16 years of age or older. The health district did that earlier this month. What vaccine can teenagers receive? And then when will those people younger than 16 be able to receive the vaccine?
Right. Currently, the recommendation is that teenagers age 16 and older, all of people 16 and older, can receive any of the 3 vaccines at this point. Children younger than 16, there still are ongoing studies assessing the safety. The efficacy seems to be there in the under 16 group, from what I've read. But they're still working on the approval process, which hopefully will come soon. I don't know what soon means. Hopefully that will be before the beginning of the next school year, but I don't know when exactly that's going to happen. But the studies that are in process to ensure the safety of these children are ongoing and vigorously so, from my understanding.
And I just want to clarify, when it's 16 and 17-year-olds currently, they're approved for the Pfizer vaccine, correct? Not for the Moderna vaccine at this time?
What I read on the Virginia Department of Health and the CDC website, I believe it was yesterday, was that um, all three of the vaccines were now approved. If that is incorrect, my apologies, but I thought that I had read that when I was going through things last night. Um, uh, Certain, I knew that the Pfizer had been approved earlier. So at ages 16 and older, is my understanding is that they can get any of the three available vaccines at this point.
All right. Dr. Cornegay, I see you've come back here. That we just wanted to confirm what the ages were for 16 and 17-year-olds, what vaccines they currently can receive.
Yeah, at this point, we're mainly using Pfizer for the 16 to 17-year-olds and Moderna for 18 and above. In terms of the timing for the 12 to 15-year-old age group, which would be the next group that's been highly studied, Pfizer has submitted an application to the FDA for emergency use authorization in that age group. And the last that I heard was that the timing could be as early as June, which would be great news, for getting kids done during the summer prior to the start of the fall school year. So we'll keep fingers crossed that timing holds true.
Thank you, Dr. Cornegay. Dr. Jestet, if I've already had COVID-19, do I really need to get a vaccine?
You do at some point. Getting the disease itself confers immunity for, we assume, reliably maybe 90 days or so. There's some evidence that the antibodies that you create against the virus itself when you catch the disease begins to decrease, and in some cases rapidly so, as quickly as 8 weeks or 2 months after the infection. It's imperative for long-term management of this disease process that people, even though you've had COVID-19, do get vaccinated at some point. There was a recommendation early on when supply and demand was an issue that if you had the disease, wait 90 days or about 90 days to get vaccinated so that there was enough for everybody so we could approach this point of herd immunity quicker. But at some point, you just can't assume that you're going to not be able to get coronavirus a second time, which there are reports of that, though rare, it does happen. So yes, get vaccinated, absolutely.
Thank you, Dr. Jested. We're talking with Dr. Laura Cornegay from the Central Shenandoah Health District and Dr. Greg Jested from Harrisonburg Family Practice about the COVID-19 vaccine. If you'd like to submit some questions, please type the questions in the live chat to the right, or you can place the questions in the comment and we'll be happy to ask them the questions. Talking a little bit about vaccine access, Dr. Jested, is the vaccine free or do I need insurance to pay for the vaccine?
The vaccine itself is free to everyone. The United States government is picking up the cost of the vaccine itself. And there may be some instances, depending on where you get the vaccine, there may be an administration fee at some sites. So just make sure that that is worked out and ask beforehand. But the vaccine itself, that by far would be the more expensive part of it, is free to you.
And Dr. Cornegay, I know you've been integral in trying to determine where these vaccines go. What's the health department and the local governments doing to ensure equitable distribution of the COVID-19 vaccine?
Yeah, I think public health and local government. One of the bright sides of the pandemic has been that even increased interaction and ability to work together. Local government or any community partners with public health, and certainly all of our lenses, point towards health equity in anything that we're doing. So I'm trying to make sure that folks have equitable access. We've had, minority groups that have certainly been affected heavily by the COVID-19 pandemic, including the African American and Latinx population, and working with community groups to ensure that those populations have access to COVID-19 vaccine has been an important part of our work in Harrisonburg. Some large industry, including the poultry industry, that does employ a lot of Latino employees, and working with them to ensure that the employees' needs as both frontline employees were met was an important initiative. There's been a lot of efforts in the health district to meet the needs of homebound patients, particularly the elderly homebound. And we have several nurses who are just assigned to that task, kind of going house to house, making sure that folks who wouldn't be able to get out to community clinics or to private practices are able to get vaccines. Likewise, we made great efforts with a lot of our group homes for disabled adults. It's often difficult for them to get to large community events, so we went up and down the valley addressing the needs of that population. Obviously, one of the severely affected populations within our communities, within the nation and the world, was folks who are greater than age 65. The risks of severe COVID disease increase as we age, so making sure that the needs of folks in both long-term care facilities and living out in the communities of our seniors were met was a really important initiative. And I'm really proud to report that within our district, we now have met that great landmark of having greater than 75% of our over 65-year-olds having received at least one dose of vaccine. As we've opened up into phase 2, basically opening up vaccine opportunities for everyone over the age of 16, we found that the demand for vaccine has decreased a bit. We've met the needs of a lot of the folks already in phase 1. And now I think the hard work is going to be getting to folks who are vaccine hesitant, who may have access issues, who may have live in a rural area, who may have language or other barriers that prevent them from getting the vaccine, and really changing our delivery method from these very large vaccine clinics to very targeted community-based clinics that meet the needs of that probably next 20 to 25% of the population that we need to get to in order to obtain herd immunity. But again, kind of working with all of our tremendous community partners to meet the needs of all the people that we live and work with on a daily basis has been the focus of our efforts to date.
And Dr. Cornegay, I know the health department and local governments have been reaching out to individuals who have pre-registered or been notified through another process. How do I know that the phone call or email that I receive about the COVID-19 vaccine isn't a scam?
Sure. Well, one thing, if you're getting called by our central call system in Richmond, the phone number for that is 877-VAX, VAX, NIN, Virginia, VA, or 877-829-4682. The other thing is, the information that the caller is asking for. You should know that you should never be asked for payment information for your COVID vaccine. The COVID vaccine is always going to be free. Somebody's asking for credit card or other payment information. Please don't divulge that. The health department does not ask for social security numbers nor immigration status. So if those questions are being asked, you should really consider not answering and reporting issues either to the local health department or to the Attorney General's office. Unfortunately, as with most things in life, there are people who seek to take advantage of bad situations. So if you have any concern that the person you're not talking to is legitimate, if they say they're a health department employee, you can certainly politely hang up, find the number for your local health department. You can call us, and we can confirm whether that's true or not.
Thank you, Dr. Cornegay. Dr. Jestet, who's currently eligible to get a vaccine?
Now that we're in phase 2 everywhere in Virginia, Dr. Cornegay just touched on that. It's everybody age 16 and above, regardless of risk factors or anything else. So, encourage everybody to do so, obviously, but that's the criteria now in this state. So,
And Dr. Cornegay, where can a person get a COVID-19 vaccine?
Right. Well, the good news now is that the situation is much different than it was back in December and January, and there are many places that you can get a COVID vaccine. You can get a COVID vaccine through public health efforts. And the way that you can access public health clinics in this area would be on our website called vaccineappointments.virginia, the whole word spelled out, .gov. That web link will lead you to links to vaccine clinics within our district and also within neighboring districts. So to the north of us, we have the Lord Fairfax Health District. To the south of us, we have the Roanoke Allegheny Health District. And they all use the same scheduling system that we do. So you'll be able to see a variety of appointments kind of up and down the Shenandoah Valley. Likewise, you can go to vaccinated.virginia.gov, and that's the state website that will you back to vaccine appointments .virginia.gov for this area. It also links you to another website called Vaccine Finder, which would allow you to access vaccines in Walgreens, CVS, Martin's, Kroger, all of the retail venues that are providing vaccine as well. We're hoping that in the coming weeks we'll have more vaccines available at private doctors' offices. As the vaccine inventory is increased, it allows us to push vaccine more out into the community. So I think the avenues for obtaining vaccine are just going to get better and better as we go on in the process.
And Dr. Cornegay, you talked about the different websites that you can visit to find these. What if I don't have a computer or email?
Yeah, if you don't have a computer or email, one central number that you can call is the COVID Information Center, which is based in Richmond. They have a few hundred operators that can answer questions and can also help you to find a vaccine appointment. And the phone number there again is 877-VAX, VAXNINVA. It's 877-829-4682. We also got a lot of help with folks who didn't have internet access and got registered on telephone with localities such as, Harrisonburg and Rockingham. So we got a lot of community help. initially getting folks registered just the old-fashioned way on the phone. We also have a lot of operators who are still helping us at the local health department to kind of guide people through if they don't have computer access.
Thank you, Dr. Cornegay. We're here with Dr. Laura Cornegay from the Central Shenandoah Health District and Dr. Greg Jestet from Harrisonburg Family Practice. If you want to submit some questions, you can do that in the live chat to the right, or you can place it in the comments below. We're going to talk about why someone needs to get a vaccine. And Dr. Cornegay, why should I get vaccinated at all?
Yeah, that's a great question. And I think in general, I'd speak to why people should get vaccines in general. Vaccines do two things. They protect us personally from vaccine preventable diseases, but they also protect the people around us. So in getting vaccinated, you're really doing two things. You're protecting your own personal health, but you're also protecting population health. So you're doing almost your civic duty with getting vaccinated. For the COVID vaccine, the benefits of that, again, personally, would be that you wouldn't get severe repercussions from COVID-19 disease. Just as with any vaccines that we have, none of them are 100% effective in totally preventing disease, but all of the good vaccines like COVID-19 are great at preventing the big complications of the disease that they're seeking to prevent. And the COVID-19 vaccines are greater than 90% efficacious in preventing hospitalizations and deaths. And that's, those are the biggies that we want to prevent. In addition, if you prevent yourself from COVID-19, you're also protecting the people around you. In particular, you're protecting the people who are most at risk for severe COVID disease. That may be your mother, your grandmother, people who are greater than age 65, people who have chronic medical conditions. So again, there's the personal benefits, and then there's the benefits that you're given to the community around you.
Thank you, Dr. Cornegay. Dr. Jestet, I know there's some different vaccination criteria and all this stuff. When will I be considered fully vaccinated?
You're considered fully vaccinated after the 2-week period after the second dose of the Pfizer and Moderna vaccines, and 2 weeks after the single dose of the Johnson & Johnson, assuming it does come back into use, which I suspect it will with some restrictions. Prior to that second dose, at 4 weeks after the first dose with the Moderna and Pfizer vaccines, it's about a coin flip. There's about 50% plus or minus protection rate. So that second dose with those two vaccines is very important. But again, 2 weeks after the second dose of Pfizer and Moderna, 2 weeks after the Johnson & Johnson, you should be considered fully vaccinated. It doesn't mean that you run around, not social distancing, not wearing a mask, but at that point, you're much safer to be in, let's say, a room with other fully vaccinated people. The level of transmission will drop precipitously in that kind of a situation.
To piggyback on that, Dr. Jestet, if I'm fully vaccinated, can I still get COVID-19 or can I still spread it?
That's still being teased out a little bit. You certainly can still get it. So with the Moderna and Pfizer vaccines, 2 weeks after that second dose, the initial study data show that you're 95% less likely to get the disease versus the people that were not given the vaccine but given placebo, randomized, everybody else is behaving the same. So it's still a 1 in 20, however you want to interpret that data. So you still can get it, you still can pass it on, and the fact that you can still get it, especially if you embark on high-risk behaviors, you're still potentially breathing the virus out onto somebody susceptible for 48 hours before you yourself develop any symptoms, which is what makes this coronavirus pandemic kind of scary, is the mode of transmission from asymptomatic people to others around them.
And Dr. Cornegay, do you know how many people have actually gotten COVID-19 after being vaccinated?
We're still collecting data. And in fact, a data element that we look at in case investigations is looking at vaccine breakthroughs. So I don't have that data to date, but like I said, it's an element that we're looking closely at.
I think I saw somewhere the other day they had said at least 5,800 people, but that's 5,800 people out of how many ever million have been vaccinated based on that data. Dr. Cornegay, if I'm fully vaccinated, what can I do now?
Sure. The CDC put out guidelines for fully vaccinated folks, which have been progressive over time, which has been nice. So the latest update was on April 2nd. One of the nice things that fully vaccinated people can now do is resume domestic travel without concerns for needing to get tested when they come back or needing to quarantine travel. So that opens up a little more travel opportunities, which is great. For international travel, likewise, recommendations are that you don't need to get tested prior to travel and wouldn't need to quarantine when you get back. The testing, however, would be dependent on what the destination country mandates. Some countries still do want tests for entry into another country, but in terms of U.S. guidance, that liberalizes travel a little bit. You can visit with unvaccinated people from a single household who are at low risk for severe COVID disease without a mask or social distancing, which is a tremendous thing for, grandparents, aunts, uncles, etc., who haven't been able to see, their loved ones, especially, young children, in a while. There's no quarantine following a COVID exposure for fully vaccinated folks who are without symptoms. Again, if you have symptoms of COVID, even if you've been vaccinated, you need to get tested and take appropriate action. But without any symptoms, you don't need to quarantine after exposure. The thing you should continue, even if you're fully vaccinated, though, are masks when you're in public and social distancing. You should continue to avoid medium to large groups. Again, you should be tested if you have COVID-19 symptoms, and you should still use masks and distancing when you're visiting unvaccinated people from multiple households or people from households where folks are at high risk of severe COVID disease. So we're able to open up a little bit with the vaccine, and certainly as we get to that herd immunity point, which is about 75 to 80% of our population vaccinated, that's going to be a great turning point for the country as a whole.
And Dr. Jetstead, if I have family and friends who are very hesitant about getting the vaccine, what can I tell them or explain to them to help encourage them to get it?
Yeah, this is a pretty touchy subject, and it's something that I do all day long with patients, not just family and friends. So one of the first things that's pretty important is not come at them aggressively and berate them for their opinion on the matter. Instead, what you ought to do is sort of inquire as to why. What's the hinge point? What's the hang up? What are you so worried about? And then once that's sort of out on the table, then what I can do is sort of present the facts. So knowing the facts before the conversation definitely does help. But come at it in a loving way, like don't just do this for yourself. Do this to help the people around you. Also, once the impediments to actually getting vaccinated are put out in front of you, so you can have an open conversation about what is hearsay and what is true fact. And teasing that out and helping people just to be less afraid of reality about the vaccines is very helpful.
And Dr. Cornegay, I know you've already shared some of this information, but where can I direct my friends and families to go to get more information about the vaccine itself?
I think a great source of information is our VDH website, and that's www.vdh.virginia, the whole word spelled out, .gov. You can click on links that'll take you to information about the COVID vaccine, where you can get the COVID vaccine, data related to COVID within your own community. So starting there is a great source of initial information. The call center can also answer most questions about COVID vaccines. And again, that phone number is 877.vax in VA, or 877-829-4682. All of the VDH guidance is based on Centers for Disease Control guidance, and their website is another great source of information, and that's www.cdc.gov. I think between those two websites, you probably get just about everything you need to know about COVID or the vaccine.
And we did have one viewer question, and this is for you, Dr. Cornegay, is the vaccine cheap to use?
Cheap to, like the cost of the vaccine?
Yeah, it would be the cost of the vaccine.
Okay, I'm not sure what the retail cost would be of the vaccine. I think a lot of money obviously has been put into production and manufacturing. Again, the vaccine itself is free to everyone. If you're uninsured, it's free. You can't be charged an administration fee. Administration fees can be charged to insurance, and Medicare, Medicaid, private insurances, will cover that cost.
And as we wrap up here, I want to give the panelists an opportunity to give any last thoughts. Dr. Jestet, is there anything you'd like to comment about here as we wrap up this evening?
I just really encourage everybody that can to consider getting vaccinated. I hope that Dr. Cornegay and I, helped make that decision a little bit easier if you're on the fence tonight. I was able to get the first vaccine with the Pfizer literally the day it was available, and I was so happy to get it. And I just wish everybody else felt that way. I just do. So I hope just a little bit of understanding and a little bit of trust and faith in the medical system as it now exists can just help everybody relax and just go about helping each other and save each other from this disease.
And Dr. Cornegay, any last comments?
I would agree with those wise words. I would encourage everyone to get their vaccine. Working in public health, I put up the same to private practitioner that I would never recommend anything to folks that I wouldn't get myself or get to my family. I'm happy to say that I've gotten my COVID vaccine. My daughter has gotten her first dose at college. My husband got the J&J vaccine a couple weeks ago, and both of my parents and in-laws have been vaccinated. So I would encourage everybody to do the same. We really need to get to that herd immunity point, that 75 to 80% of our population vaccinated, to try to return society to a more new normal state. In the meantime, we need to continue to be vigilant with our mitigation efforts. Again, masking, social distancing, trying to avoid large crowds, hand washing, and following up if you do have symptoms of COVID disease, despite your vaccination status. One thing I should mention in terms of access to the vaccine, we talked about the fact that you can call in, you can find an appointment online. You can register for vaccines online. With the vaccine inventory increasing, we're also having walk-in opportunities in a lot of our clinics. So, keep that in mind as we go along, and you should have plenty of opportunities, hopefully, to easily get a vaccine. And please do that not only for yourself but for the community around you.
Thank you, Dr. Cornegay. I want to thank both our panelists, Dr. Laura Cornegay from the Central Shenandoah Health District and Dr. Greg Jestet from Harrisonburg Family Practice. I also need to thank Laura Lee White, the Public Information Officer for the Central Shenandoah Health District, and Michael Parks, the Communications Director for the City of Harrisonburg, for helping to put this event together. I also want to thank you, the viewers, for taking time to watch this session. Without everyone working together, we wouldn't be able to fight COVID-19. For more information about the vaccines, you can visit the Center for Disease Control's website at cdc.gov, or you can visit the Virginia Department of Health's website at vdh.virginia.gov. If you're interested in receiving a vaccine, you can visit the website vaccineappointments.virginia.gov, or you can call VDH at 877-829-4682. You can also visit harrisonburgva.gov/vaccine and find a link for local vaccination clinics. If you found this live stream helpful or want to be notified of future events, don't forget to subscribe to the channel, like the video, and please provide us comments and click the bell to be notified of future videos. For the City of Harrisonburg and on behalf of our panelists, I'm Paul Helmuth saying good night and be safe.
Well done, everybody.